Hello, everyone. This is Betsy Wurzel. You're a host of Chatting with Betsy on Passion World Talk Radio Network, a subsidiary of Global Media Network, LLC. Our mantra is to educate, enlighten, and entertain. The views of the guest may not represent those of the host of the station. Folks, I love doing my show. I love providing people with resources that will help them, which I didn't know about when I was caregiving or which weren't available when I was caregiving. And my heart will always be for the caregivers, even though I interview guests from all walks of life. I started interviewing caregivers. And I was a caregiver myself, as you all know, if you've listened to me. And with me today is a wonderful resource. With me today is Pat Hobson. She is a speaker, a healthcare leader, expert, and author in dementia care. She is an expert in safeguarding and management of complex inequalities cases, tackling, healthcare inequalities, empowering organizations to transform complex care and systems. She is founder and director of PMH Consultancy and Education Ltd. She is author and writer of Enabling People with Dementia, Understanding and Implementing Person-Centered Care, which is in its 4th edition. Wow, that is wonderful. And I want to welcome Pat Hobson, calling from England. Welcome, Pat.
Thank you so much, Betsy. Really pleased to be here.
Oh, you are welcome. It's my pleasure. First, I want to welcome you, and I love talking to experts in dementia care and health care. There are inequalities in healthcare with dementia to begin with. You add on top of that, if somebody has another condition such as Down syndrome or autism, makes it more complex. And how did you get into this field? I'll start with that.
Goodness, I mean, I suppose my interest in dementia started at a very young age. So it's sort of going back to the late 70s, and my grandmother sort of came to live with us, and my mother was the main caregiver for my grandmother. And at that time, I suppose a little was very sort of known about dementia, and but she obviously did. When we look back now, she actually had dementia, and I think it was later sort of identified as vascular dementia then. And so it was her experience. I think my journey was sort of mapped out to sort of do law. And halfway through, I decided to change course and decided to go into nursing. And when I qualified as a nurse in 1991, I went straight into working with people with dementia. And of course, throughout the last 3 decades, I've really focused on sort of becoming that sort of expert in it and drawing my experience of what it was like for my mother and the challenges for caregivers primarily was one of the focus that I have sort of gone on to sort of refine, because I think there is a lot that needs to be done. So I've sort of been working a lot with different organizations, but over the last couple of years, my focus has been more on caregivers who are sort of the people that are looking after people with dementia on their own a lot more now. And I think it's reflective everywhere we go in the world that is one of the key roles, really, is that as people with dementia remain more in their own homes, there is a greater emphasis and importance on then what we would refer to, for example, in the UK as unpaid caregivers, because they are your husbands, your wives, grandparents, and grandchildren that are sort of at the forefront of looking after people with dementia. So it started at that very young age, and having that passion based on what my mother went through when my grandmother came to live with us, really.
Well, we have a lot in common, Pat. I worked as a nurse, and my husband's grandmother had, back then, like late 70s, right, early 80s, my husband's grandmother lived with his parents. She had Alzheimer's, but they didn't call it Alzheimer's back then. And that was my first introduction, other than when I worked in a nursing home as a teenager. But it wasn't called Alzheimer's. It was called organic brain syndrome, senility. I never heard the word Alzheimer's as a student nurse back in the Stone Age in 1975, 76. Excuse me. That Alzheimer's was never mentioned. My mother-in-law, well, she was like my second mom. My mother-in-law had Alzheimer's, and that's when I really got smacked in the face with it, because I didn't know anything. And, in it was 2000, there wasn't much information 25 years ago at all. So I say she took me to Alzheimer's school, because there wasn't much information about sundowning, hallucinations, and I didn't know how to handle it. My dad had Alzheimer's. My husband, he had early onset. So by the time that came along and was hallucinating, I knew how to handle it because of education. And, Pat, there's one thing I always say on my show is education for the caregiver is vitally important. It makes such a big difference. I know firsthand the difference it makes. So I always push education and being an advocate, because we must speak up if they're not getting, if our loved ones are not getting, or if we're not getting the care that they are deserving of. And I don't know. I mean, it's different, everywhere. And I don't know, how it is in England, because you have a whole different, healthcare system than we do here in the States. I have found in my nursing career and on a personal experience that people who have dementia or people who have cognitive disabilities are not treated with dignity and respect.
Yeah, absolutely.
Do you find that in England?
I think it's one of those key challenges, I think, and I think I explore that, quite a lot in my dementia book, because I always have this sort of approach that we have to examine ourselves first as individuals, whether we're a professional caregiver or one that's sort of looking after someone at home. We have to look at ourselves first of all, and our perception of how we see the person with dementia, and challenge that perception, because until we change the way that we view people with dementia, we will struggle to really implement what we call person-led care, which is the most sort of advocated care. And I teach a lot about even the most basic terminologies that we use on a day-to-day basis. Are they, sort of the language that sort of undermines or threatens people with dementia's dignity? And I think that when we talk about person-led or person-centered, we are talking about that person being in control all the time. So because they lead us, not the other way around. And often the people with dementia are dictated to, and people tell them what they should or shouldn't do. Actually, they are the experts in their own care. They tell us how they want to be looked after or what they need. And I think one of the things I always find, Betsy, is that the caregivers are the experts and the person with dementia in that individual, not us, professionals. We're not. And so when we go into people's homes and work with caregivers, we are working with them as partners. We don't go in there and tell them how to look after their loved one. We go and empower them and enable them to do it.
Yes. That is so true, Pat. I just want to hug you through the airwaves. Because you said that the caregivers, I say this all the time, I have a support group on Facebook. We know our loved ones, and my husband, unfortunately, had the home hospice from hell experience, and they didn't believe me that Matt was terminally agitated. They didn't believe me that he was dying. And I, would call up. Nobody would come out and assess him. And the social worker from the hospice came to my home and accused me of not giving the medication properly and blaming me about Matt's condition. And so I had to put her in her place, which I did, because you don't come into my home and disrespect me. And I told her, I mean, my husband never complained, and he said to me, Pat, as clear as day, I have a headache. So I gave him Tylenol. She had the nerve to say to my face, he couldn't possibly have a headache. I said, what are you, a doctor? Do you know what a dying brain feels like? You have no right to say that. And I told her in the hospital, because we had another meeting, I said, caregivers, we know our loved ones, and you need to listen to us. I said, because I'm telling caregivers, we're not taking this crap anymore if you will not listening to us. If we think our loved one is dying or in pain, they're agitated, you need to believe us. And it's very frustrating to, you're under enough stress, right, caregiving at home. And then you're dealing with people, professionals, who don't believe you and are not respecting you or your loved one. So
I completely agree, Betsy, because I've sort of developed a pathway that sort of focuses on a person's uniqueness, and in that pathway, I allude to the fact that we, as human beings, we're all sort of on a journey, really, of life, if you want to call it. And at different parts of that life, we encounter, situations that will obviously have an impact on our lives. So the aspects that I talk about is the almost like your dementia journey that you go on, and from the minute you're diagnosed to end of life, and that's what the pathway looks at. And at the beginning of that journey, you've got the person with dementia is the driver in the driving seat, and they are sitting there in control, and the person next to them is what I would refer to as their assistant or their conductor, is their caregiver, their loved one. And and we as professionals are we're just passengers. We hop on and off that person's bus throughout their lives. They don't change. It's us that change. So we are the ones that have to adapt to meet the needs of the person, not the other way around. And that's what's very important, is that as the dementia progresses, as you know, Betsy, it's very difficult for the person to obviously adapt and change. So we have to and maximise their health and well-being, whether it's coming into the person's home and helping them to adapt the environment so it becomes more enabling than disabling for the person, then that's what we do. And I think, going back to your point about education, it is absolutely crucial, because when I reflect back later on, after when I started to talk to my mum about what was happening with my grandmother, and the one thing she said to me was, if only I knew that is what was happening to her, that would have really helped me to understand and be a bit more patient with her, because she thought my grandmother her behaviour was, she was doing that deliberately, really, when actually it wasn't that at all. And I think that's the reality of it. I think is that knowledge is really important to support the care.
Yes. Oh, that is so true, Pat, because with my mother-in-law and I did not know about Alzheimer's, like I said before. So when she accused me of stealing, and unknown to me at that time, she was telling everybody I was stealing from her.
Oh,
I was stealing her house, her jewelry, her annuities. And I didn't know she was doing that out in public. Nobody called to say anything. And I just thought she was being a witch. I didn't know that came with the disease, paranoia, and delusions. So I didn't handle it correctly. And that's why I really am a strong advocate for education. And I know caregivers are busy. And I know caregivers will say, oh, I don't have time. And you know what I say to that, Pat? I'm a New Jersey girl, so I'm very blunt. That's my New Jersey sass. I say, listen, if you have time to binge on Netflix or Hulu, you have time to listen to professionals, take a course, listen to a podcast, do it at your convenience. But it is so important to know how to handle their behaviors and the hallucinations.
Absolutely.
Because what some people do, as you know, is they'll argue with the person.
Absolutely.
Oh, no, there's, no men in here. When to them there are.
Yeah.
And
absolutely.
I would have handled my mother-in-law quite differently if I knew back then what I knew now.
I completely agree, and I think that's often what you hear a lot with caregivers is that, and I think one of the things that as the dementia is progressing, is the person as people lose their ability to actually voice how they're feeling, behaviour becomes the communicating factor, and so what might appear to you and I as a behaviour that's a challenge, to a person with dementia, it's obviously an expression of how they're feeling and communicating with you. And that's why caregivers are best placed to be able to understand when we professionals go in and we say, well, why is the person behaving this way? But knowing the person's background and what they either did before and can help to understand some of the behaviors that might be happening. They may look unrelated, but actually when you map them all out together, they actually have a meaning. And I always say to people, there is no behavior that a person with dementia displays that hasn't got a meaning. It's our inability to understand that meaning that's the key. So we need to be looking at beyond what the behavior is telling us and making sense of it and listening to the words, but most importantly the words. But the word may be a word, but actually the behavior may be telling you a completely different story. And so it's really about focusing on that 90% of our communication, which is our body language, I suppose, really.
Yes. So, as caregivers, we have to be detectives because our loved one may not be able to communicate. They have a urinary tract infection, as you know. It will exacerbate their dementia, any kind of infection. And, or they're hungry and they can't tell you, or have to go to the bathroom and they can't verbalize it. Yes, they're going to get agitated. And I used to be in a lot of support groups, Pat, and I was just amazed that unfortunately, there are support groups that don't allow for education for their caregivers. And you see and hear caregivers. I'll never forget this one lady wrote, my mother keeps going to the bathroom in her diaper. I tell her not to. Why does she do that? Now, if this woman would have educated herself, she would know that her mother can't help it. She would know that, and she would know how to handle it. And it is just so important. My husband was diagnosed in 2010, and he died in 2020. They didn't know in 2010 what they know now. And I couldn't figure out why he couldn't see things right in front of him. Like, why could not he see that? Why his vision was distorted until I listened to a video by Teepa Snow about vision and how your vision gets affected by Alzheimer's or other dementia. And so after that, I became less frustrated and I was more understanding. I'm like, oh, well, now I better stop yelling. Not that I yelled at him, but I say, what do you mean you can't see that? But this is what I'm talking about. This is why I'm so passionate, Pat, for education.
Absolutely.
Which brings me to your book. Your book, is that a manual for learning about dementia and how to handle behaviors? What is your book about?
Well, it's a combination of sort of very key topics. So I mean, the most important thing is all about understanding what dementia is, and we look at it from what we call because we don't look at it as a disease. We look at it more as the disability. So the disease part of dementia is still going on in the person's brain, but what we promote is that we promote the other key aspects of the person, and which focuses on helping them to live more of a meaningful life. So rather than say focus on what the person cannot do, it promotes actually advocating what the person can still do and maximizing that. So it looks at obviously communication, managing behaviors that challenge, and it looks at the role of caregivers and re-enablement, which is what I'm sort of trying to articulate, which is about empowering people and enabling people. So re-enablement is all about helping people to maintain skills as much as possible, and it's a global thing that's being advocated right up to the United Nations and the World Health Organizations, because what we are saying is that we want to be focusing on the positive aspects of maintaining people's skills more and better, and rather than just say person's got dementia and writing them off, which is what you often see. And it's all about the person's strengths, really. So it's written in a way that, either if you're a caregiver or professional caregiver, then you can still relate to it and read it. And in there is obviously the pathway that I've just described, which I am currently promoting across the board, is that you it's called the unique life pathway, which is all about making sure that the care that you give is based on that individual's unique skills. So you don't compare people, you don't compare person with dementia, because no two people with dementia are ever going to be the same. So it's all about considering the person's background, and because we all know that most people with dementia, as the dementia progresses, they go back to their background. So what they did 50 years ago is what they're doing now. And which is why caregivers are best placed to be able to support it, because they know that the reason why the person's doing this behavior now is actually when they were 20, they used to do that all the time. So we can then understand that a bit better, so that we can then adapt the way that we're looking after the person to reflect that actually what they're doing is not out of the ordinary. It's actually part of who they are and based on their background. But what we need to do is to enter the person's reality and make sense of it, rather than let the person come out of their reality and expect them to make sense of our reality. We have to do it the other way around and enter their reality and make sense.
Yes. Dan, that is so true, Pat. And a lot of caregivers get so hung up on that. I can't do that. I'll be lying to them. I can't lie to my mother or father. Well, you're not lying. You're going with them. You're living in their world, which is much better than agitating them by arguing with them. When Matt started to hallucinate, and it's so weird how people hallucinate about different things. He would always hallucinate about men, hitting him in the head, men, and he was worried about me because he would say, Betsy, don't go over there. There's men there. And, he would tell me he was concerned, so I would reassure him. Oh, okay, Matt, I won't go over there. And, if he thought there was people in the house agitating him, then my son, Josh, our son, we became improv actors. We would kick everybody out of the house and reassure Matt that he's safe. And that, is more beneficial than to say, oh, no, there's no one here, and argue with them about it, which will only escalate into a huge problem. And that you don't want, folks. You don't want to escalate the situation where the person with dementia can become violent at times because they're so agitated, you're not understanding them. And that could be helped, Pat. That could be, just not get to that situation if caregivers would educate themselves. And I'll keep saying it, even though I might sound redundant, because it is the truth. I've seen it in my own caregiving experiences, how education made me a better caregiver, and it made Matt to have a better journey because I understood him. I understood what was going on.
Absolutely, and I think that is a really important point, actually, Betsy, because what we're talking about is whether the person is distressed about something. And when we talk about entering a person's reality, what we are saying is that, in the very early stages of dementia, you can bring someone back to reality. So you can say to them, actually, the person's still able to reason with you in the very early stages. But as the dementia progresses, that ability to reason is obviously affected. So when you're telling someone, for example, if they turn around and say, something, I'm going to see my mother, for example, and they're not 90 years old, and you telling them obviously your mother is passed isn't going to work as much as it would work with someone who is still able to reason with you in the very early stages. It won't work. It's only going to distress the person more. So when someone is asking for mother, to me that's an unmet need, as particularly the dementia actually progresses. So what is the significance of mum? Is the person agitated when they're asking for their mother? Are they saying, I want my mother, and they're really distressed? Because that then becomes indicative of an unmet need. And we all know, when we go back to our childhood, who would we want to see when we are in pain? Who do we call out to when we are hungry? It's those significant things in our lives, whether it be people or places, that makes us feel safe. So the focus is on the emotional needs and making that person feel safe. So you recognizing that actually the person's asking for their mum, or they're asking to go home, but actually they're really distressed. It means actually it's all about an unmet need. Something is wrong, and you need to find out what it is that is wrong. So if you say, oh, you are home, Pat, for example, that isn't going to make a difference if I'm hurting somewhere or I'm in discomfort and I'm trying to communicate that to you, but all I can do is actually do that in the only way that I would ordinarily do if I needed someone to fulfill an unmet need. And things like mum, mother and father and all those are quite significant and powerful, sort of examples of what we would use as children to fulfill our emotional needs when we're frightened, really. So it's the significance of it, I think, is the key that we need to be looking at.
Yes, and that near the end, Matt would say, I'd say 6 or 7 months before he died, he would see his relatives that deceased, his mother, his father, and his brother. And, he would say, oh, my mom came by, or, his dad or his brother. And I would go, oh, that's great, Matt. Did you have a nice visit? How are they doing? I wasn't going to argue with him. And near the end, he would say, I got to get out of here. I got to go home. Now, Matt lived in his childhood home, and before I knew not to say that, I used to say, but Matt, you are home. Then I just got to say, okay, Matt, I'll take you home after you eat breakfast. And he would forget that he said that until he would say it again. And I would just tell him, yes, I'll take you home. And I would ask him about his mom. And it's so, I might sound like a weirdo, but I think their hallucinations are just so interesting. And sometimes we think they're hallucinating, but they're actually talking about an event that happened that they kept a secret.
But I think obviously hallucinations and delusions are different from the person's reality. So, if the person's talking about something that's happened in their past that is significant, that happened, that would not be a hallucination or a delusion. That is a reality that actually happened.
Right.
And of course, and so there is a difference, and the response is different. So a person's reality we are talking about is things that have actually happened in there. So for example, if I used to be a teacher and at 3:00, I start talking about children. I start talking about all these children everywhere. I need to sort of help them to make sure that they do their homework properly. To me, that would not be a hallucination or a delusion. That is a reality, because it's the person is in their reality because they did that. They were a teacher, and that's what so the response will be different to the response when someone's hallucinating, which might be a frightening thing, or a delusion that may be a frightening thing. You would respond differently to that, as opposed to something that is a person's actually saying to you, I'm teaching. I'm at school at the moment, and I'm teaching, and I'm doing this, and they're quite happy. And so the way you would respond to that would be slightly different. And I think that's the bit that we help relatives to caregivers to understand is what is the difference between a person's reality, a delusion, and a hallucination, or something that is frightening to the person that's causing the person distress. Because if the person's not distressed about something and they're talking to you about something, and it's not up to us to be correcting that individual, because they're talking about something that is meaningful to them. It may not be meaningful to us, but it's meaningful to them. If it's not causing them distress and they're talking about something significant, then it's all about empowering that individual, because the focus should always be on alleviating distress and anxiety. Yes. That is the focus. Is we don't want the person to be distressed. And if our response is distressing that individual, then we just, it's all about, as you said earlier on, trial and error. We try a different approach. It may work tomorrow. It may work very well today, but it may not work tomorrow. So we've got to keep adapting, and the person leads us on with that. And all we do is obviously adapt and continue to see what works and what doesn't, and hence trial and error is the only thing that we can do. And as professionals, we do exactly the same as well when we're working with people with dementia.
That is so true, Pat, about being adaptable and adapting, because a lot of caregivers, I feel, they don't want to adapt. They expect the person with dementia to adapt to them, and that's not going to happen. And I know that I had to learn to adapt, and I had to learn to continuously readjust. Whatever your routine used to be, you might have to break that up. Like it was too much for me to shave Matt and give him a shower. I had to do one or the other because both was too much. Yeah. So you adapt. I couldn't do it at night because he was more agitated at night. So you learn these things through trial and error. Yeah, and absolutely. I found music and it's proven music does help those who have dementia, and it's amazing how music really is beneficial to them. Have you seen that in your work?
Absolutely, and I think that's a very crucial part of what we call, when we talk about meaningful activities. Music is one of those very key, what we call unstructured activities, and whether the person starts sort of spontaneously singing and their favorite song, and you join in with them, or it's a structured activity where you actually have music type activities that are based on a person's significant era in their lives. It is one of the most powerful, and there's been a lot of research where people, even with advanced stages of dementia, who people may have felt are no longer engaging, and music has been played based on their significant sort of memory, and the person has just burst out into a lovely, beautiful song, really, and then that then becomes the focus of continuing to enable and create meaningful activities that are based on music. So it's a very, very powerful activity, to use continuously. So you can be a combination of that with other activities. So it's keeping a person with dementia active is the focus. So when we talk back about reablement, it's focusing on what the person with dementia can still do. Because if you focus on what they can't do, that's when they become frustrated and agitated, and that's when you have behaviours that challenge. And if the activity is too much, then it's a case of you stop, you reevaluate and you reflect. It may be the person's not ready to do it, and then you carry on. Whereas music is sort of something that, if it's the right music and one that is designed to create a calming atmosphere, it can be a very positive thing to use. Definitely.
Yes, I found it very helpful. I would play, my husband loved Johnny Cash, and so I would play Johnny Cash when giving him a shower because it would help relax him, and sometimes even with eating. And I played his favorite music when he was dying. And I just feel that it really helped, and it's amazing because you never know what they were thinking. Like, for years, if Matt heard Glenn Campbell sing Wichita Lineman, he would say to me, my father worked for Public Service, CSE&G, that's our electric company, and he was a lineman, which was true. And he would say my dad was an alcoholic, which was also true. But he remembered that. And I thought it was, dementia really, to me, it just baffles my mind because here Matt couldn't pick up a fork to eat, and yet he could hum a whole song. I just thought that was incredible.
Yeah.
The way the brain is.
Yes, absolutely. Which is why it's important that we are the ones that adapt, because the person with dementia is no longer able to adapt. So we have to are the ones that have to adapt. And because if you try to make them, that's when they become frustrated and, understandably so, agitated, and that's when you get behaviours that challenge, really.
Yes. Yeah. And then the caregiver's like, oh, well, they hit me. Well, what happened before that happened? I'm sure they were agitated. It's I can't stress enough education. Pat, your company, PMH Consultancy and Education Ltd. Do you counsel people, organizations? Can people get in touch with you, like Zoom, anywhere in the world?
Anywhere in the world, because we have a knowledge center that we've built, which we have a section for caregivers specifically. So we offer free courses for caregivers on there, and then we also give them a free resource that all about, it's learning to care for your loved ones and looking at the different things that you need to initially do. And there is obviously ongoing support. So we would help a caregiver in a situation where they feel they've nowhere else to go. We will unblock wherever it is that's preventing them from getting support. Because one of the things we say is that not to suffer alone, that there is help out there, there is support out there. It's all about focusing on the needs of the person and involving professionals when things aren't going so well. But most importantly, it's also about finding ways to look after yourself as a caregiver, because there is no point in continuing to look after the person, because then there is a risk that you yourself can become overwhelmed. And from my experience, that's where I've got involved when something has happened to both the caregiver and the person, because they're just so overwhelmed. So we need to capture those instances much earlier, and we sort of support to identify at what point you would need that help, and to make sure that you keep those channel of communication open with various organizations and professionals that you can call upon to support you. So we help with all those, but most importantly is the education bit that we help caregivers with by offering the free courses.
Wow, that is really great to know. That's why I love talking to people who are wonderful resources, such as yourself, Pat, because it's so important to know, because when you get a diagnosis and you're sitting there in the doctor's office, they're overwhelmed. And it's like, where do I go? Now, maybe it's different now than it was 15 years ago or 25 years ago. There wasn't any help. There wasn't any guidance, but now there is. My neurologist who took care of Matt, and I go to see him for my migraines, he told me that, well, his wife is a psychiatrist for a geriatric psychiatrist specializing in different dementias, and he told me, he said, Betsy, they are now focusing on the caregiver.
Yes.
And the caregiver taking care of themselves. And hallelujah, it's about time.
Absolutely.
Because
absolutely.
Yes.
And I do talk about that in the chapter, because in my book I've got a whole chapter dedicated to caregivers, and I talk about that's one of the things I really emphasize is looking after caregivers and helping them. And in the UK, I don't know, it might be different in other parts of the world, but there actually is a specific law that we have got where one of those aspects of the law is dedicated to assessing caregivers to make sure that they are supported and signposted to help them to look after their loved one better when they have got that responsibility. So I think it's very important that we, caregivers know the help that they need and where to go, and how they can access that support timely before things escalate, that they are no longer able to cope.
That's true. That is very true. It is overwhelming, and I'm grateful that I am still healthy and doing well for having done 15 years of caregiving. 10 with my husband, 5 with my mother-in-law, and I'm just so passionate about resources. And I want to thank you, Pat Hobson, for coming on today and sharing what you do. How can people purchase your book? And
yes,
I know it's on Amazon.
And yes, it's on Amazon. But obviously, if they want, there is a free version that we offer. That's just sort of a guide, an initial guide. If they want to sort of get in touch with us, then they can go onto our website and just send us an email, and we can send them the sort of free guide. But the book itself is on Amazon, available on Amazon. But But obviously, again, if there is any problem with that, people can just get in touch with us and we can support. Definitely.
And what is your website? How can people get in touch with you?
So
your company.
It's www. And I'm going to spell it out. So PMHCANDE.com.
Can you repeat that again?
So it's www.PMHCANDE.com. So it's PMH company.
Okay. Well, I certainly enjoyed chatting with you, Pat Hobson. And the name of the book, folks, is Enabling People with Dementia, Understanding and Implementing Person-Centered Care. It's the 4th edition. And Pat Hobson is founder director of PMH Consultancy and Education Ltd. Thank you for what you do, Pat. Thank you for helping others. You're welcome.
Thank you.
In England and all over the world, we need more people like you.
Thank you
out
so
there.
much, Betsy. Thank you. I appreciate that. It's been a pleasure.
Thank you. Yes, likewise, Pat. I want to thank everyone for listening to Pat Hobson today. Go check her out. Go on Amazon. You know the book has to be good if it's in the 4th edition. That tells you something right there. And I urge everyone to always check out my guest website because there's so much information about every guest that I have on that I can't possibly tell you during the interview because I want to talk to the guest. And I want to thank Jeannie White, who writes the blog, and all the information about Pat Hobson will be in the blog. And Jeannie produces the show. And I want to thank Lillian Caldwell, who is CEO of Passionate Rules Talk Radio Network, who makes this all possible. Excuse me. And if you don't already subscribe to Chatting with Betsy, it is for free on Spotify, Spreaker, iHeart, Amazon Music. I have a great guest lined up for next year. And I highly recommend you listening. And please share this show because I want to help as many people as possible. And people need to know about Pat Hobson, and that's spelled Hobson. I'm here to help people. Pat Hobson is here to help people. And that's why the show needs to be shared. And really, when you do share the show, it's helping others, and it is honoring my husband, Matt's memory, because it's because of Matt that I do the show. And you can follow me on Facebook, Betsy E. Wurzel, Wurzel. And as I always say at the end of my show, in a world where you could be anything, please be kind and shine your light bright, because we need it now more than ever before. This is Betsy Wurzel, your host of Chatting with Betsy on Passionate World Talk Radio Network, a subsidiary of Global Media Network, LLC. Bye-bye now.